All right, so a lot of kids have been returning to school, sports. They're doing a lot of the summer training. They're gearing up for their seasons to be starting. And a lot of my runners have been coming in with lateral knee pain or outer knee pain, and every single one of them has blamed their IT band. And very, very common because they go on to Google for 2 seconds and they say IT band pain. So your IT band is actually a non-contractile tissue, so a lot of times it's more under tension stress than actual inflammatory pain. So the IT band attaches approximately at the hip at the tensor fasciae lata, or the TFL muscle, and it runs down the side of the leg to attach to the outer knee. So a lot of times that outer knee pain, you're seeing something in this lateral chain. Commonly in students and in student athletes, we see a lot of weak hip abductors or abductors, glute medius, glute maximus, and that's usually due to how much they're sitting. And then a lot of times with the prolonged sitting, you get a lot of tension in the hip flexor, which starts to create some changes in how hip mechanics work. So commonly, due to weak hip abductors, your TFL is going to start to pick up the slack a little bit. Unfortunately, it's a very short muscle, so I commonly explain it using my pants here. Imagine that the pocket here is the TFL, and the seam of my pants is the IT band. Well, when this guy gets overworked and contracted, it's going to increase strain on that IT band, pulling at the lateral knee. So commonly when someone comes in and they go into, I have lateral knee pain, didn't have an injury, I go right to examining the hip. After I rule out any kind of significant knee path, right to the hip, right to the TFL, you just lay some pressure on that TFL and they light up. So it's very, very important to, one, control the inflammation at the knee, but also realize that that's usually just the victim and the bully's elsewhere. It's usually a hip problem leading to increased strain at the knee. So getting into your hip abduction strengthening, getting into your good soft tissue release for your TFL, a lot of people right away, they start rolling out the IT band. Once again, I think the IT band is just the victim, and that lateral knee is the side of pain, but a lot of times it's that tight hip complex that's causing these symptoms. So today I want to get into just some strategies on how we can kind of correct that at home. All right, so some of the exercises that we really want to make sure that we're incorporating when we have this outside knee pain is both at the knee and the hip. So I'm going to start off with some hip exercises. All I have here is a AirX stability pad, simply for knee comfort. You don't really need it. A pillow works just fine. We have one of the road bands here that we have anchored around the squat rack. All I'm going to do is bring that up to the hip here. That side's going to go down. This is going to add a little bit of distraction on the hip joint to help accentuate the stretch a little bit. Your first movement with this is making sure you have a nice strong core here, and we're going to go into what we call posterior tilt of the pelvis. Getting into this position here to maximally stretch the tissue. Problem is, too many people do the stretch without the tilt, and then they just lean forward. Unfortunately, without the posterior tilt, you're not going to get an effective stretch. So imagine your belt buckle coming towards your belly button, or pockets down to the knees, to really turn that muscle on, and from there you're going to hold that stretch. Honestly, 30 to 45 seconds are to your tolerance. This would be a good exercise to do, especially post-run. More dynamic before we work out, but more static after. But really to help start loosening up that hip flexor so we can start correcting that hip complex, okay? So you're gonna do both sides here. Transitioning to get into the more of the outer hip, what we're gonna be doing is to get into a dynamic version of a pigeon. So I'm gonna get into a hands and knees position here. Same thing, you wanna make sure you have the stiff core here. You're going to extend the right hip and drop that over there to really get that lateral hip stretched out. And this one you can do more repetitions to get more of a dynamic stretch, to really get the hip capsule, the outer hip, TFL, and you'll actually feel this in the IT band a little bit too. So as far as sets and reps go, just getting equally on each side. Few second holds for each rep, 5 to 10 reps on each side, depending on how long you want to hold it for and what you're trying to achieve. But like I said, this is a really, really good stretch, not only for the muscles, but the capsule as well, for the hips to start really loosening up that hip complex. So as I mentioned before, a lot of times we see weakness in hip abduction. A lot of times it's the glutes that aren't working as effectively, and that is going to help or cause the TFL to start to engage a little bit too much. So getting into your lateral chain activation exercises, your lateral walks, your clamshells, your bridges, all of that is fine, whatever you find is best for you. One of my favorite exercises is to kind of a spin on the clamshell. And what we're gonna do here, I got some loop bands. This here now is gonna be a pillow support, but what we're gonna do is we're gonna put a band around the knees, put a band around the ankles here. From here, we're gonna get into a good side position. And from here, it's kind of 2 clamshells in one. What we're gonna do is first separate the knees, keeping that separation, then we're going to pivot at the ankle. So we're getting both external rotation and internal rotation training with one position. So it's a very powerful exercise. You're gonna feel this fatigue a little bit quicker than a standard clamshell. But like I said, you get to really challenge the hip complex in multiple planes of motion. So here, I like to just really go until I feel that engage. So 8 to 10 reps with a good hold at the top is fine. Switch over to the other side and repeat. So a quick, simple strategy to kind of help with that outer knee pain. Obviously, consult with your primary care, your chiropractor before you begin any of these exercises. But a lot of times what we see with this lateral knee pain is that it's hardly to do with the knee at all. It's usually a hip dysfunction that has led to some overdrive in changing the way that you're moving and recruiting muscles and non-contractile tissue like the IT band, leading to more inflammation at that side of the knee. So making sure you have good hip flexor mobility, making sure you have good hip abductor activity, so a lot of the glute strengthening exercises that you've seen us do before, and then also making sure that you're not rolling out the IT band like crazy, because a lot of times that non-contractile tissue is already inflamed, and a lot of times it doesn't make your pain less, it actually kind of increases more discomfort. So stay off the foam roller on the IT band. If anything, start focusing on that hip complex, the piriformis, the TFL, the glutes, to really help treat not just the site, but the cause of the pain. So try it out.